Hello everyone. Welcome to today's phlebotomy webinar on pediatric phlebotomy with pain management, creating an optimal experience. This is Heidi Zunker, an Education Program Manager for Mayo Clinic Laboratories. Our presenter today is Ryan Halda. Ryan is a Laboratory Service Assistant Supervisor for the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. Just a couple of things to remind everyone before we begin today. There will be a question and answer session at the end of the program. You can submit questions online via the chat function, or following the presentation, phone lines can be unmuted to ask a question. Today's program is being recorded and will be posted to our website in a few weeks. And now I'll turn the phone over to our presenter.
Good morning, and thank you for joining me today for our webinar session. My name is Ryan Halda, and I'm Assistant Supervisor in Outpatient Lab Services at Mayo Clinic Rochester campus. I've been with Mayo for about 6.5 years. I got my start as a lab tech working overnights at the hospital, mostly as part of the pediatric team in the NICU and the PICU. From there, I moved into the outpatient setting and worked my way up to the lead position on the pediatrics floor. And now I'm currently an assistant supervisor of 3 outpatient locations, including the pediatrics lab here at Mayo Clinic Rochester. Today, my presentation, Pediatric Phlebotomy with Pain Management, Creating an Optimal Experience, will contain multiple aspects of pain management. Pain management isn't just about numbing creams or spray products that have physiological effects. It is also about understanding the child's behavior and how to handle different situations that arise to effectively provide a positive experience for the child. Within my presentation, I have nothing to disclose. So today's learning objectives, upon completion of this presentation, I would hope that you would be able to differentiate some behavioral consideration amongst the various age groups within the pediatric population, that you would be able to recall products and techniques used for pain management, and that you would be able to incorporate the skills that you learned today into your daily work to provide the best care possible. First thing that we need to know about the kids that come into our phlebotomy area or procedures is that they have a lot of fears. I kind of compiled a top 10 here of fears that the kids may have. You can see that kids are afraid of the dark, they're afraid of strangers, they don't want to be alone, hospitals are scary for them, just going to a regular doctor visit or dentist might be fearful for them. They're angry, the angry people or disapproval, the failure, and a big thing that they're afraid of is the unknown. So really being aware of that when they're coming into the office and coming to you for a lab draw or a procedure, if they don't know what's happening, they are going to be fearful. And they're afraid of making mistakes. So as you can see with this whole grouping, all these fears can happen in one location. So for them to come into the doctor's office or the hospital, there's many of these fears that are being together in that one spot. We're strangers to them. They don't know who we are. We don't know what we're going to do to them. And being alone. If we or the doctors step out of the room for a minute, they feel alone. So just knowing that the kids are fearful and things that we can do to help overcome these fears will provide a better experience for the child, the parents, and for us. 2 primary areas of concerns. Successful pediatric phlebotomy consists of 2 skill sets, recognizing the needs of the patient, the parent, and being able to fulfill those needs. So really focusing on the individual themselves and the parents and how we can overcome those fears and the apprehension of the parent and the patient. And then also understanding of pain management products and techniques that allows the phlebotomist to collect the best possible sample with minimal distress. So knowing the resources at hand, knowing what products that you can use, whether it be numbing cream or sprays or just different techniques of distraction, any of the resources that you have on hand that'll help with that, help ease their understanding. So then we get into kind of some of the behavioral considerations that of different age groups here. Consideration with neonates. Neonates range from birth to about 1 month of age. At this stage, there's a strong bond. So separation from the parents is traumatizing for both the neonate and the parents. We really got to recognize that. The neonate, with them just being born, all they know is their parent. They're totally dependent on the parent and the adults. So being separated from the parent is definitely going to be traumatizing for that child, but also for the parents, especially if it's their firstborn. Being separated from that child is going to be traumatizing for them. So just realizing that strong bond there and trying to help minimize that as best we can. So as for dealing with the neonates, you really want to speak softly. The child is going to be startled easily. So handle them gently, speak softly, have a nice calm voice. We want to be able to keep that patient as comfortable as they can, and really acknowledge the parents. That's what we're really talking about here with that close bonding, is to really acknowledge the parents. Consideration with the infants. Infants are from 1 month to 2 years. With this, they start with that social interaction. They still have that bonding, but here is where they're starting to be reinforced. So they really begin to build that trust daily. Every action that they have, they're getting some sort of reaction to it. So at this stage, they're really trying to figure out if they do something or act a certain way, if they're treated in a positive reinforcement, they're going to trust it and want to do it again. So really focus on that, is if we can make it as positive for them, the more that they will trust us and trust the procedure that they will be doing. Infants are still easily startled, so you really want to use the same mindset that you did with the neonates in the infant population. You want to really be kind, speak softly, and really handle them gently. If the child has bonded with some kind of object, such as a pacifier, or it could be a security blanket, their favorite blanket, or a stuffed animal, really incorporate that as best you can into the procedure. If it's something that makes them feel safe, something that's going to make it better for them, really incorporate that and let them have that object with them. And really encourage the parents to assist in comforting the child, that you want to have them involved in providing distraction. They still at this age with that bonding, to have that parent or the adult right there with them, comforting them, will help tremendously. Into the toddler stage. Toddler stage ranges from about 2 years of age to about 5 years. And the early stages, they're still a bit self-centered, but they're starting to become a lot more independent, and they're definitely trusting a lot more. So this is the stage that they start to become a little more self-assured, take on responsibilities, and they're able to interact a lot more. So knowing that they're very curious and they want to do things themselves, but they're really like a sponge and really want to learn things. So know that communication is very important. This is where we're going to start to let them know of what we're going to be doing. We want to explain the procedures to them, but as we're focusing on explaining the procedures, we really have to be careful of the words that we use, because we really want to not have the word association. If you're talking about like, here comes the poke, or it's going to be just a stick or a sting, this means ouch to them. And we really want to be careful of that because we don't want to associate things in, for one example, I know some phlebotomists will use the word, oh, this is going to feel like a mosquito bite. Well, if we have that word association, now when they're outside and they may say they see a mosquito, now they're terrified of mosquitoes because they associate that with the venipuncture that they just got. So really focus on the words that you're using. You want to explain to them, but you want to be honest also. And use words like 1, 2, 3, here we go, instead of here's your stick or here's your poke. So really be careful of the language that you use. And you really want to involve the parent with the procedure and encourage their cooperation and support. So still working close with the parent, have them involved as much as possible. They're a great person for distraction. At this age, distractions are a great stage to use because they are the toddlers are more interactive and a little more inquisitive. So interacting with different games, or if you got any books or iPad, child life specialist or music therapy, if that's something that has at your facility. But any resources that you can use to provide that distraction will work tremendously in your procedure. And really do a wrap up. You want to praise the child, whether it be stickers, ducks, bracelets, pencils, anything that you have, just to reward them and really praise them for getting through something that was fearful for them. They overcome their fears. They got through it. Even if it was a difficult time for them, we really want to praise them and show them that they did a good job. With school-age children, they range from about 5 years of age to about 12. They're very social individuals at this time. They don't like failure or criticism. Now they're in school with friends and other classmates, so they have a real strong need to feel liked and accepted. They fear that failure. They want to be just like everybody else, and so know that. And they start to show their independence. So oftentimes it will be negative. They start being rebellious, start showing bad behavior. It might be just their way to deal with their fears. So just be aware of that there might be situations that they are getting a little out of hand, but there are ways that we can overcome that. The biggest way that we can become over that is answering their questions. They will have a lot of questions and they have a lot of opinions at this stage, so be prepared to offer honest answers to a lot of different questions. At this stage, they're starting to know a little bit more, so they can tell if you are lying to them. So just really be honest with them, answer everything that you can for them, and really use the distractions to get the job done. This is a great stage there. They're highly interactive now, so use all the resources that you have at your disposal to be able to provide the distractions for them. And really offer praise regardless of the outcome. Rewarding experience will set the stage for future success. Even if it starts out bad, that they're acting out a little bit, or they're fearful, so that's kind of how they act, but they get through it. They overcome their fears and they got through it. So you want to not necessarily reward the beginning part where they were acting out, but that they accomplished something. They got over their fears. So definitely still offer that praise and that reward for them. Consideration with adolescents. The most important needs is that of autonomy, the real need to maintain privacy and intimacy. They begin to experiment with social roles. They're looking for that leadership and that guidance. They're looking for a role model, somebody to that they want to be like. They're fully developed in the communication skills. The sexual identity develops. This is when they're going through puberty and trying to find themselves, so be aware of that and really kind of maintain that privacy with them. They reach decisions on needs for themselves. So this is where we really want to focus on holding those conversations at an adult level, and you really want to get them as involved as you can. When you're having the conversations with them, involve them in the decisions, where they want the blood drawn, how do they want it done. Ask them about their past experiences, their good and their bad. What worked for them in the past? What didn't work for them? The more you know about them, the better chance that you have for a good experience. And then also let them make the choice with, like even with parents. Do they want the parents to stay in the waiting room? Do they want them just outside the door? Or do they want the parents involved? But let them make the decision. At this age, we really want to focus on them making decisions for themselves, and they would really appreciate that, and makes experiences so much better. And really answer their questions completely and honestly. Now, dealing with parents. That's always a big thing when you're talking about the pediatric population, is what do we do with the parents? But depending on the severity of the illness, the parents' emotions run high, and they may include fear of loss. We don't know what they were just shared with the doctor. We could be the very first appointment that they had just after hearing the worst news that they just have ever received from their doctor. They might be blaming themselves. They might be asking themselves, what could I have done different? What could we have done? Or they might be in dismay and shock. So just knowing that they are going through many different emotions, and we don't always know behind the scenes of what's happening. And because of those emotions and how they're running high, they may exhibit behaviors in dealing with those emotions. They might be in denial, saying that this isn't happening, that it's a misdiagnosis or something, it's not happening. Or they might be angry. They could be angry at anyone or everything, and that's how they handle it. It could be bargaining. Let this be me. I know probably every parent out there has always had that feeling when their kid has been sick, whether it just be, the flu or a severe illness. Let it be me. I would rather take the pain and the discomfort than having it for them. They might be in depression, or they might have even accepted it. It might be something that they've experienced before with another child or another family member, or they've just gotten to the point that they're just accepting it. So just know that every situation, everybody deals with it differently. So just knowing that there are different ways that the parents are dealing with information that they've just been given. And really find the time for the parents. Take the first step to initiate conversation. Be proactive versus reactive. That's a big thing with parents, is as much conversation as you can give them, and be the first one to start it. They want to feel that they're included. Include them in the procedure. Ask for the history. Ask for what has worked in the past. Get their input. And you really want to explain your procedure, if you're going to use some comfort holds, and this is where you want to get and seek their involvement. See what they're comfortable with. Are they comfortable with the hold? Are they more comfortable of stepping out and not being involved in there? Maybe they can't handle that situation. So really focus on getting that conversation and finding out as much information as you can. And realize that you are the healthcare worker, you're a professional, and they look to you for answers and support and guidance. So they may have a lot of questions for you, and sometimes they just need to vent. So just know that they've got a lot of questions and things running in their minds, so they might be asking you different questions, and just make sure you answer them completely and honestly for them. And explain the procedure and the understanding and recognition of the distress associated with it for both the child and for them. This is focusing on empathy. They just want to know that you have the best interests for their child, that you're not, that their child in front of you is not just another number of a blood draw that you're going to do, that you really care for them, and you're there for their child and also them to make it as the best situation as possible. And what happens when that parent gets angry? So this is a key thing to know, and I think we've all been there if we're in the doctor setting, being a phlebotomist, is recognize that you're an easy target. Never take it personal. It's just how that individual may handle something. Like kind of we were talking before of the how individuals handle things. They could just be angry at the world, and you're an easy target. You could be the first person they see after they were told this bad news, and they just needed somebody to lash out. But communication is paramount. Be proactive. The more you can talk to them and talk them down and try to comfort them, and just know, usually the anger arises that they just want the best for their child. So the more you can communicate and show them that you're here for them will help a lot. And really assure the parents. And give them an out. You might be surprised that sometimes they may have never gotten the opportunity, that they're having a tough time handling different situations, that they just need to step away, but they've never been given that opportunity. They feel that they have to be there. So definitely give them that option. And if you just see that they're just struggling of being in there, you can ask them if they would like to step out, and then you can come and get them as soon as we're done. You might be surprised that that may really work for you. But if it gets really out of hand, you may have to ask them to leave. If you at any time feel that they're providing an unsafe environment for yourself as the technician or for their child, you definitely may have to ask them to leave, and get the nurse or the physician involved. Have them talk to the parent. Never feel that you have to go in harm's way to complete your job. But most importantly, find in your heart to forgive the angry parent. It's their way of dealing with it, and like I said, don't take it personal. Just be able to forgive them, and the communication, just try to communicate as best as you can with them. So the phlebotomist's role in the outpatient care setting, you really want to work as a team. Kind of know your coworkers and work together, whether it be somebody that's coming in just to help hold, or somebody, say you need a third person to help dispense the blood into the tubes. Really work together and kind of acknowledge the parents as you're doing the procedure with them. And the big thing is assessing the parents' tolerance and taking appropriate action. You can read the parents and just see what they're able to do. Maybe they're sitting there and they're feeling uncomfortable. You see them kind of pacing or turning white, or things that you can kind of read, and maybe you have to ask them, do you want to sit down, or do you want to step out? So you really want to assess the tolerance of them, and also using that is how much they'll be able to hold. If you think that they don't feel comfortable of holding the child to be able to make your job easier, have them step away and grab another teammate. Communicating with one another without causing concern or alarm to the parents or the infant or child. This is really key, and you get more experience with this the more you work with your coworkers. That the more you've held for each other, the more you've worked and involved, you kind of build on cues of how you can communicate with one another without causing any concern. In the outpatient environment, you want it to be bright, cheery rooms filled with distractions. This is an example here of our waiting room here on Mayo 16 on the pediatrics floor here in Rochester. As you can see, you've got the pillars are all trees, and all the light fixtures are big leaves, and we have a Minnesota theme is the theme of our waiting room and our entire floor. We have the Mississippi River on the floor that starts at the elevators and then goes throughout the floor. And then we have different things on the walls, different animals. And on the back wall, we have a huge I Spy. The whole wall is I Spy with a key there that has different animals that you're supposed to search out and find. So you definitely want that environment that's calming for the children and interactive, just so that they have that nice calming environment for them. And with distractions, so this is where we're now getting into the painless intervention and some of the different resources that we have that you can use to provide those distractions. Child life therapists, music therapists, the iPad, the Magic Box. We have a Magic Box that has it's a box that just has different resources. One of those is I included a picture there is the coloring book of magic. The kids really enjoy this. It's how you hold the book, you flip it, and as you flip through, the pages are blank. And if you hold it another direction, you flip it through, then you have all the outlines, and then you hold it a different direction, and then now it's fully full color. So we use that a lot up there, and the kids really enjoy that. Buzzy the Bee, it's a vibrating bee that you can put on your arm that has that vibration. It kind of helps numb and distract them. Different I Spy books, and then individual techniques. All phlebotomists can get their own knacks. An example, I know of one phlebotomist that can make little bubble noises out of their mouth and stuff, and really works well on infants. I've seen that, and she does a really good job there with that. So just having the different techniques that you can individualize and use on your own. With child life and music therapy, child life specialists, if that's something that you have at your disposal in your facility, it's great to use. You really want to work as a team. You want to know each other's processes, so you can work off of each other. So if the patient is very apprehensive and very nervous, and the child life wants to start out, that specialist can work with calming them down, kind of explaining what they're going to do, but then also go into what the phlebotomist is going to do. So if they know the phlebotomist's procedure, they're able to incorporate that in their talk with the child. And then that also goes the other way too, is if the phlebotomist is the first one in there and kind of talking, letting them know what they're going to do, and then also tell them what the child life is going to do. So you really want to know each other's process and really work together as a team. It really allows the phlebotomist to focus on the draw when you can have a child life or music therapy adding that distraction. And then you really want to keep the motto of one voice. So we're all working together as a team for the same purpose. So you want that same message, whether it's from the specialist or from the phlebotomist, is keeping that one voice motto. Now getting into different anesthetics, there are advantages and disadvantages to all the different products out there. Advantages of different anesthetics that you can use, it's the psychological benefits is just by providing something for the patient and the parents, they just see that you're doing something for them. When we talk about the different topical creams, we always mention to the children, it's a magical cream. You're not gonna, it's gonna help so you don't feel it as much. So just telling them that, they start to comprehend that. And then the physiological effects, it does work. It does numb, so that there are advantages of that. Disadvantages, it can be incorrectly placed. If you're not the one that applied the cream and you're doing the draw, they could have put it in the wrong spot. It could have been a nursing staff or another phlebotomist that put it on, and then when it was time to draw, they were in with the difficult or called off the floor. So now somebody else has to draw that, and it could be incorrectly placed. So that could be a disadvantage. It is messy, as it is a cream, so it doesn't always stay exactly where you want it to stay. And it is time consuming. It does add time to the appointment, is ranging anywhere from 30 minutes to 45 minutes to an hour, depending on what you're using. So knowing that, I know with us here in Mayo Clinic Rochester, we have it built into their appointment guide saying if you are interested in using a topical cream, show up a half an hour before your scheduled appointment time, so we can get that on there, and then it can start to be effective. So then when we are ready to draw that, we haven't added any more time to their stay here. So with the topical cream, it is applied directly to the site. So right where you're going to assess the vein, see exactly where you want to go, and then you can put on that cream, and it is going to numb that site. It's used on ages 30 days or older, so that's recommended there, that not to be used of less than a month old. So that's a consideration there. Delayed collection time, depending on the type of cream that you use, I think the lowest I've seen is about a 30-minute wait, and then it goes up from there. So just knowing that and adding that into the time of the appointment. And then knowing the allergies to topical anesthetics. So you definitely always want to ask the parents or the patient if they're allergic to any topical creams, because we don't want to create any allergic reactions. So this is something that we did here at Mayo Clinic Rochester on the pediatrics floor, as kind of we had a joint effort initiative with the nursing and the desk staff. So prior to January of 2017, we were kind of averaged right around that mid-30s to low 40s of patients that used the topical cream. When we're kind of getting to a point where we're looking at it and asked ourselves, why aren't we making sure everybody knows about the opportunity? Because before it was kind of ones that you could see that it could benefit, and we would definitely ask them, or ones that already knew about it and would talk to us and requested it. So then we really worked with nursing and desk staff is during the doctor visit or meeting with the nurse, letting them know about it, but then also incorporating the desk staff that every single pediatric patient that checked in at the desk, they were asked, do you want to use a topical cream? So everybody had that opportunity, and once we started that initiative, as you can see with the graph, that very first month that we introduced that, we doubled our usage. And then even throughout the year, we're able to double that again. So we really made an effort to let everybody have that opportunity, and that's when we put it on their appointment guide that any child that had an appointment scheduled, they would automatically have some notation of a topical cream. And then, as you can see, as we kind of dipped there in April, but that's the start of, we had Epic go live here, so our numbers were reduced. But as we've gone forward, even since then, we've maintained a pretty high level of compared to what we had. Another product out there is an oral sucrose. It's a 24% sucrose delivered via pacifier or syringe. So basically it's sugar water. It's used primarily on infants and newborns up to 6 months of age. It has been requested for ones over 6 months of age, but it's studies have shown that it's not that effective once you get a little bit older. So it's definitely recommended for just the 6 month of age and younger. It is classified as a food product. That makes it a lot easier for us to be involved with it. It's not a medication that we're handing out. So we are able to even give it to the parent or guardian to use it during the procedure. Here at Mayo, that's the route that we went to, is having it administered by the parent or guardian, because if you have the nursing staff, prior to that we had the nursing staff comes in, now we're taken away from what they need to do just to administer the oral sucrose. And then if we didn't have them, we would have a third phlebotomist in the room just to apply that. So because it's a food product, we can give it to the parent and they can administer it as they go, and then it gets them involved in the procedure also. As for patient safety, really working as a team when performing these collections, working with the holding and collecting, working off of one each other, really getting the parent involved. And like I've stated a few times before, if the parent is comfortable, if you see that they're not comfortable of holding their child, you may have to get another phlebotomist to come in and help with that hold. But it definitely eases the anxiety in both the parent and the patient if you can get them involved. Some of the comfort holds that we use. This is a swaddle technique. And as you can see there, we use a blanket that wrapped the child to help immobilize the other limbs, the legs and the other arm, while the arm that you want to do the procedure on is readily available. And then by having the parent help and hold with the arm over the child, that helps them stay so they're not having that excess movement to help you perform the venipuncture. And then also they can get right next to the child and provide that comfort. Comfort hold for the toddler, as you can see, it's the positioning of the parent is a lot of the same, but now the child is a little bit older and it's harder to wrap up in a blanket in the swaddle. So this is a really good way to help immobilize all those other limbs, yet still having the parent right there face to face with their child. And then the comfort hold for school age. This one works very well, that you get the parent involved. Sometimes, a lot of times it's good too that if the child is a little bit small for the chair, so it's kind of a little booster. You got a little parent booster there, and then the parent can really get involved, wrap the arms around to help them stay still, and or just get that comfort of the holding of the child. And then with this, you can still utilize a lot of those distraction techniques. The parent can be involved. They're looking at the iPad together. Other things that you can kind of notice in this picture is on the armrest, there is an I Spy there, and behind the patient, we have some speakers, so we can always hook an iPod up there and have some music playing. There's a picture behind the phlebotomist there that have a few different things to look and find in there. So as you can see in here, you got a lot of different things that work with distraction and having that comfort hold for that child. As for difficult collections, there are a lot of different techniques. A really good one is using the HEAT philosophy. Really, the H is for hear the patient or the parent, their suggestions. If they're a difficult stick, this isn't the first time that they've gone through this. So they might have a good idea of what worked in the past, what didn't. So really hear their suggestions and definitely include them if it is at all possible. E, examine all possible collection sites. So look different spots of the arm. If you have to go to the forearm or the hand, or if applicable, use the foot. So you definitely want to see any of the spots that you can to be able to provide a good blood draw. A, apply heat to the site. Sometimes you might have to add heat just to help bring the vein up to the surface. And T, team up. Team up with a coworker. If you can't see anything, can't feel anything, and you've done all your tricks to see what you could do and you're still not finding anything, grab another coworker. Maybe it's just a different set of eyes or a different technique of feeling that they might find something. So really work together as a team. And if you are going to use some sort of heat to warm up the site, make sure it's a commercial warmer. You never want to use a wet warm towel. You're okay to use a heated blanket, or a lot of times what works really well is heel warmers. So just apply those to the site and see if that helps just to bring the vein up to the surface. And for venipuncture equipment, think small. Matching the needle size to the vein is critical in maintaining the integrity of the vein. For infants, especially preemies, a 23 gauge needle is probably recommended. And then as the child gets older and their weight increases, their veins get larger, you may move up to a 21 gauge needle. So just knowing the veins that you're choosing and getting the correct equipment is going to make a better success for you. So correct equipment choices and the correct technique is going to equal success. Then patient satisfaction. We always want to see how we're doing and wanting to see if what we're doing makes a difference. So we have different surveys that we use throughout the year. We have paper surveys. The paper surveys we'll print off and hand to all the parents and the patients for them to complete. We do that every quarter. Then we also have the Prescaney survey that you can use off of an iPad, or we have cards that are made up that they go to a website and can input their surveys results. Comments. Some of the comments that we've received is love the music therapy and prizes. Staff were great. We have another one, did the use of the topical anesthetic improve the lab collection experience? Very much so, plus the person assisting and providing a visual of what will happen and choices of what to do on an iPad during the blood draw was amazingly helpful. Thank you. We had another one that said, did you come to the laboratory to have a blood drawn on a patient 12 years of age or younger? Said actually he was 13, but developmentally he is younger. Best visit ever. We have been coming for 13 years now, and this is by far the best visit. Thank you. So we really use these to see how we're doing, and then also for areas of improvement. With the different comments, we can look at those, and we do look at those to keep improving and keep providing that best care that we can. And thank you for your time. And if you have any questions, we'll go into a question and answer.
Yeah, this has been great. Thank you, Ryan. As he noted, at this time we would like to take any questions that you have. So if you'd like to ask a question through the phone line, you can press *7 to unmute your phone. And then once you have finished asking your question, you can press *6 to mute your line again. Also, you can submit a question via the chat function on the CenturyLink web application. Is there someone on the line?
Hi, Ryan.
Hello.
Hello. Hi, I'm Erin Fender. I'm the phlebotomy educator at Children's Hospital and Medical Center in Omaha, Nebraska.
What?
So I had a quick question for you. When you have a difficult draw, how many attempts do you guys usually put forth?
So we're able to, for the individual tech, they get 2 attempts, and the patient themselves gets 4 attempts. After that, we have to get approval from the doctor. So at that point, if the first phlebotomist tried twice, second phlebotomist came in, they tried twice. Now we contact the physician, said, we've tried 4 times. Is this critical that you need and want us to continue, or do you want them to try again some other time? And then it's up to the doctor.
Is that just for outpatients, or do you utilize that for inpatients as well?
That's inpatient also.
Okay. Well, thank you very much.
You're welcome. I do have a question on here of any special consideration for autistic patients in an outpatient setting. That's a very good question. With children that are in the autism spectrum and or with other mental health issues, it's important to ask the parents what has worked in the past. Each child is different, and they should be addressed that way. So with the autism, make sure that you have the resources to offer what they need. For example, kids with autism, it's helpful to have things that are sensory available to them, whether it be weighted blankets or there's balls with bumps on them. And for kids that are really sensory, that can't really do much with the sensory, that they kind of want to avoid a lot of people. So you might want to have less people in the room, maybe have one person do all the talking, but really try to keep things calm as possible. Try not to overload the child, but the communication is huge in talking with the parents of what works for them, and kind of really building off of that. So my biggest tip for working with autistic children is keep it as simple as possible, and just try to keep everything calm and really have that communication with the parents. I have another question on the chat about who would apply the numbing cream. It's most beneficial is if the phlebotomist can apply that, because especially if they're the ones that are going to do the stick, they're the ones that are assessing the vein and which one that they would like to do. So ideally, it's the most ideal is the same person that is going to do the draw be the one that puts on the cream. But there are different opportunities and stuff too that we've seen even here, that sometimes the nursing staff, while they're in the doctor visit, will apply some. That if it's something that they feel, if they can kind of assess the vein and kind of feel which would be a good spot, that's sometimes helpful. We've also seen parents have put it on before they come and stuff too. But the ideal would be for the same person that does the blood draw to be the one that applies that cream. Another question on here, what do you do in the case where a parent is clearly making the patient more anxious, but the child still needs to be held or distracted? That's where you're really getting your teammates involved, whether you have Child Life available or just having another team member come in. That if you find that the parent is making that child more nervous, you can ask them to step out or even just step aside and just have another teammate, another coworker step in and help you with that. A question is, what is the policy of the amount of blood that can be collected at one time on a newborn? That's weight specific. So depending on the child, there are different weight charts that we use here at Mayo that we can only take so much, and they kind of have it's nice that we have it set up for our phlebotomists that they can just enter the weight in the calculated table, and it'll give us how much that we can take. And with that, it is a pretty, it's set to be pretty lenient, but we caution, we kind of, anything that we're getting close to that number, we definitely want to talk to the doctor, and then we also record of what has been taken prior to, so we kind of have an idea of the max that we can take daily and the max that we can do for a specific draw. A question on the numbing cream about putting on where you see the vein, or do you do both arms just in case you have to switch arms? It's a great question. We put on both arms because you never know that if one site doesn't work, you would hate to have to go to the other side and not have the cream or make them wait another 30 minutes. So we will put on both arms. It gives us multiple possibilities, because even putting it on the first arm, one, if you feel that this might be an option, but then you look on the other side, there's a good one there too. So you definitely want to increase the options that you have at hand when you're ready for the blood draw. There's a question on here, do you use cold spray? For that, we don't. If a patient requests it and wants it, we can have nursing staff apply it, but because they can, in their protocol, they use it for injections and that type of thing. But with our director here at Mayo there's not a whole lot of studies out there yet of if it adds to contamination rate with the blood draw, because it's used for the blood draw and not just an injection. So until further studies have been done, we don't currently use the spray. good question here that says, I've noticed that some patients seem much more anxious when they see the needle. Do you have any suggestions to block what they see? This is where we utilize, if you've got somebody in there that's helping with the distraction, whether it be the parent or the child life specialist or just another phlebotomist, if we have like a I Spy book or some kind of book, we're able to show them the book and even kind of position the book that it's blocking their view of the arm. So we use that technique a lot, and just keeping it out of sight for them and then trying to distract them in the other direction. And then under the another question of under heat, mention the foot as an area to collect from. Does this require doctor approval? Yes, it does. Anything that we, at that stage, if we're having a tough time finding a vein and we can't find anything else and we do see something on the foot, it would be a recommendation, but we would have to get the approval from the doctor. So we would, sometimes they have it, if they've had it in the past, they may have an order in their chart, but we would call or page the physician and get approval before we're able to do that. And then we have a question on there. Do we ever use 25 gauge needles when doing a pediatric collection? Yes, usually on my presentation we had the 23 gauge needles. That's generally what we use. We do have access to 25 gauge needles and stuff too. So on preemies or pediatric patients that we really need that smaller size, we do have access to the 25 gauge needles.
Okay, we are actually at the top of the hour here, and I see that there are several questions coming through. In fact, there's a lot to weed through here, so I apologize if we did not get to your question. But I would like to thank you all for participating in today's phlebotomy webinar. If you do have any additional questions or we did not get to yours today, please indicate them on the evaluation that will be forwarded to you shortly. Please note that laboratory credit is extended for this program. Upon finalizing your evaluation, you'll have the option to claim credit and print your certificate. As a reminder, this program was recorded and will be archived on our website in a few weeks. Please visit the education website for more information on upcoming education offerings and a list of upcoming phlebotomy webinars. The next phlebotomy webinar will be on August 28th from 11 a.m. to 12 p.m. Central Time on pre-analytic variables. Thank you again for joining us for today's webinar, and have a great day.